Hello, and welcome to this week's Ethical Dilemma in Science, where we're going to ask the question, why do ethical dilemmas in science matter? Fighting misinformation on the impact of science on society. Okay, so if we start out with, in a 2019 survey of the Pew Research Center, they saw that the vast majority of Americans have felt that there is a benefit to society that has come from science. Roughly 3 out of 4 people felt that science was having a mostly positive effect on society. 23% was relatively equal positive and negative effects. But the vast majority, as well as a majority of people, felt that science was going to continue to improve their lives going forward. So again, as a scientist, that's a good thing. Americans say science is good and providing a benefit to society. But if we take a look at this, just a few years later, again, a survey by the Pew Research Center in February 2022, so relatively recently, has shown that there is a decline in the trust of Americans to scientists and other groups, including medical sciences. And if we take a look at this, we can see that it has declined relatively recently, but there is a pretty dramatic difference between the trust of Americans in scientists, whether their political leanings are more towards the Republicans or the Democrats. And so we've got about 90% of the respondents that identified as Democrats or leaning Democrats had a favorable impression of scientists, where only 66%, so instead of 9 out of 10, 2 out of 3 Republicans or Republican-leaning individuals had felt that they could trust a scientist a fair amount or a great deal. And you could say any survey, may or may not kind of show the view of the American public or any public at all. But this is another survey conducted by the Associated Press that again shows it over a greater time course. And so if we take a look at this, we see that the red lines representing the Republicans and Republican-leaning individuals, the blue line indicating Democrats and Democrat-leaning individuals, upwards to about 2006, there was, probably within the margin of error, very little difference between American trust towards a scientist. But we saw that by 2008, we're starting to see a divide that's occurring. And this divide has only exacerbated as we've gone through the COVID-19 pandemic and our response to that infectious disease. So that right now, 2 out of 3 Democrat-leaning individuals are favorable and trusting of science, where about 1 out of 3 Republicans can say the same thing. So we're in a situation where there's growing distrust, especially within the Republican Party, towards scientists and the use of science. Now, a big portion of that is an expansion of misinformation about science in the public sphere, indicated here within a Proceedings of the National Academy of Sciences symposium and journal that came out in 2021. And then a follow-up article in the journal Science from earlier this year in 2022 that have indicated that this rise in misinformation of a whole variety of levels is impacting on individuals' kind of understanding and acceptance of science issues. In the 2022 article, there was actually a quote that says, "Misinformation has reached crisis proportion. It poses a risk to international peace and interferes with democratic decision-making, endangers the well-being of the planet, and threatens public health." And so if we take a look at this and apply it to a recent setting, the best example, and the example that most of us are still thinking about as our children are getting ready to return to the classroom this fall, the coronavirus, COVID-19, emerged in January 2020, and it was an unknown disease. It was related to other coronaviruses that we had seen and began to address previously, but this was novel. It was more severe, had more severe effects, and it was more widespread. It was much more contagious than what we had seen before. But even within the first month of its kind of publicized and kind of public discovery, and began looking at information, huge amount of misinformation about the extent of the disease, how risky the disease was, and the scale that we could potentially have. At that point in January 2020, I don't think we could imagine the world that we lived in over the last 2 years. And so if we take a look at that, one of the responses was that how are we going to mitigate the risks of the spread of this disease? Making public health initiatives, one of which was mask wearing. And again, a survey in July of 2020 by NBC News shows a big divide in mask wearing tendencies of individuals, with Democrats roughly about 86% of Democrats said they wear masks the majority of the time or every time that they go out, where Republicans, it was less than half. And so we saw a situation where Democratic-leaning political party had an effect on the kind of acceptance of the potential responses for mitigating the risks associated with the disease. A year later, so in March 2021, a year after everybody went into that 2 weeks to flatten the curve, it was an unbelievable world still in 2021, but it demonstrated that we didn't know a whole lot about the disease as it first emerged, because it was a novel and unique disease. And so we made an effort based on our current understanding, and that understanding continued to change over a period of time as scientists and medical scientists learned more and more about COVID-19 and the way that it was spread. And so one of the big concerns about COVID-19 and COVID-19 responses was the fact that the guidelines and the recommendations continue to change over time. And so this is an article from the Los Angeles Times, a timeline of the CDC's advice on face masks. Taking a look at it, it changed over time. And that change was in response to learning more about the disease, and to be honest, as the disease started to change. So now we're sitting here in 2022, and so taking a look at this, the original COVID-19 virus emerged in China in 2019. But since that time, over the last 2 years, we've seen the development of variants of the disease. So basically, the COVID-19 virus changed over time. It evolved over time. And as it changed, its characteristics changed. The science associated with it changed because those characteristics changed. And so, we've heard of alpha and beta and gamma and delta, and now, we're in the midst of an Omicron outbreak as we take a look at it going into the fall of 2022. Each one of these variants of the disease has slightly different characteristics. In many cases, we'd see that the variants were becoming more contagious rather than less contagious. We're now with Omicron seeing that the vaccines that were developed to the earliest form of COVID-19 back in early 2020 are not as effective at recognizing the Omicron variant of COVID-19 because it's changed. Because the virus itself has changed, the characteristics have changed, and it is good evidence that we need kind of additional, and new variant-specific vaccines to be made available to respond to this current version of the COVID-19 vaccine. Now, if we take a look at this, and we take a look at the misinformation, we take a look at the different responses and the different kind of adherence to the COVID-19 mitigation strategies, we can see, that something is going on, that this misinformation is impacting on how we as individuals are responding to that virus and this infectious disease. And so if we take a look at this, and I'm dropping a quote from Neil deGrasse Tyson, the good thing about science is that it's true whether or not you believe in it. And so we have this situation. We had very early on kind of a belief that coronavirus, as it was originally called, was a hoax. that as it urged into, or the name became COVID-19, a more kind of recognized scientific name to go along with it, we started to learn more and more about it. But many people felt that the risks were kind of overhyped. And there were arguments as to whether or not we should go into lockdown. There were arguments as to, should the focus be on public health protection or should the focus be on maintaining the economy? And so if we take a look at this, and again, focused in within the United States, and this is a New York Times article from February 1st, 2022, we can see that in terms of cumulative deaths per 100,000 individuals within the population, the United States is highest overall as of 2022 in comparison to kind of wealthy developed countries. And if we take a look at the deaths associated with the Omicron wave, we are seeing that we've got 50% more deaths than many of the other countries that are going to be compared with. And so, the American response to the Corona-19 virus wasn't as effective, according to this data, as what other countries were experiencing. And lots of possible reasons associated with it. But one reason highlighted within this article, again, February 2022 New York Times article, is taking a look at vaccination rates. And we can see that the vaccination rates in the United States for initial vaccination are much lower than those countries that we're compared with. And for boosters, we're much, much lower than the majority of the other countries as well. So potentially that difference in the death rate could be looked at by the response of the public to getting the vaccine. And there's probably other factors as well. But why is this significant? And getting back to that question, why do these ethical dilemmas in science matter? And so we take a look at this. And this is an early essay from 2020, looking at the COVID-19 and the pandemic. And it's an article that highlighted that originally the Spanish influenza epidemic in America reported it had significantly higher incidence in working classes. And this challenged the view that the flu was going to hit the rich and poor alike. A claim that we heard over and over again with the COVID-19 pandemic is that we're all in this together and that the virus does not discriminate. And yet, if we take a look at the data, and this is a 22 article in the American Journal of Public Health, what we can see is this straight line is kind of across January through looks like December of 2020, taking a look at the expected deaths, and that's the straight and dashed line. But we see this orange as being an excess mortality, an increase in mortality, and the orange is an increase in response to COVID. The red is in response to all other causes. And what we can see is, there's a slight increase in some of these populations, so like the white Caucasian individuals, the Asian population, relatively low. But then we take a look at the American Indian, Alaska Native, so our indigenous personnel, our indigenous citizens, black individuals, very, very dramatic increase, Hispanic individuals. And so we can see that there are health disparities that were exacerbated by our response to the COVID-19 pandemic. And because of that, the effects of the pandemic, the deaths associated with this pandemic, were adversely affecting some populations more than others. And so that gives rise to this ethical dilemma in science. If we can't agree on the science, then how do we make decisions on the use of science? And I'm using this example with infectious diseases and COVID-19. Hopefully, we're kind of at the tail end of the COVID-19 pandemic, but there's still huge health disparities. And, we've got monkeypox now that is circulating and potentially becoming endemic as well. There are other, potential viruses that have the potential to go out and have a very devastating effect on the population. What can we learn from the science? We're going to be looking at this response, and was a response that some people did versus other people, some countries versus other countries. What was the appropriate response? What was the most effective response? And I don't want to say appropriate because people used the information that was available to make the best decision possible. We can apply this question to climate change. How should we be addressing this increase in droughts, this increase in temperature we saw in summer 2022? How do we come about, promoting the use of less polluting energy as we go forward? And these are the types of things that we're going to be addressing within these ethical dilemmas in science. And so please see the description below for additional information and references. As always, thank you for listening to this Ethical Dilemma Science. Thank you and have a great week.